Thanks for the invitation to come and present today. I think maybe scheduling-wise, it might have been helpful for maybe some of my content that I'm going to talk about to have come a little bit earlier. So I hope it doesn't duplicate some of the excellent content from Rob's talk earlier. But I'll try to place some of the stats and some of the measures that I'm going to talk about in a Welsh context. I primarily conduct research on the psychological processes, the neurobehavioral underpinnings of gambling behavior. But we've also recently undertaken some research on the epidemiology or the population psychiatry aspects of gambling behavior in the UK. I'm going to touch a little bit on that a bit later, but does anyone know where this is?
Singapore?
In the right geographical region. Pardon?
Kuala Lumpur?
No, a bit further north. That's Macau, which is just off Hong Kong. It's a special economic region of China. You may be surprised, it's the world capital for gambling. Vegas is so last year, so last decade. All the money, the most money in the world is being spent in that place at this moment in time. Macau gambling revenue almost is 10 times more than that of Vegas per visitor. These are data from 2012, Macau coming out on top, Australia, Singapore, and so on, so Vegas down in lowly fifth or so. So there's a reason why everyone's going to Vegas on holidays. It's because the hotel rooms are very cheap, because the casinos need to make money because they're not making enough money from gambling. So Macau is where it's growing. It's the world capital for gambling. In terms of the quantities or the scale involved, last year, the total gambling revenue in Macau fell by 3.3%, leading to only gross profits of $28 billion, only $28 billion. In the UK, you might talk about gambling losses being around 12 to 18 billion losses. So the scale in one small region where there's half a dozen or so casinos with easy access from Hong Kong, an awful lot of native Chinese gamblers, but an awful lot of tourist-led industry, gives you an idea, I think, of the scale that's involved. In terms of the losses involved in gambling, this is some interesting stats published in The Economist earlier on this year. Again, it shows Australia and Singapore as being the best losers at gambling in terms of the biggest gambling loss per resident, adult dollars-wise. You may be surprised to see Ireland feature as the third biggest loss centre in the world for gambling. So a small country like Ireland with an currently unregulated gambling industry can lead to quite considerable international global losses. In terms of Britain, the biggest loss by country, a dollar billion quantity, Britain features at around 18 billion. United States overall, biggest loss by country, 116 billion. Within these quite astronomical, often hard to fathom stats are personal stories, personal suffering, personal losses. And you don't have to look very far in Wales at the moment to contact some of these stories. Gambling addiction apparently is a huge hidden problem in Wales. Individuals, very, very brave individuals, such as Sarah here, who has undertaken counselling and support from Winford's service down in Cardiff, of which you'll hear a lot about in a few minutes, have been very brave in coming forward and raising the profile of exactly what they've gone through and what they've experienced. Sarah's case in particular is very unique because we don't tend to associate problem gambling with women. Once a gambling problem is identified, how is it measured? Some of the presentations earlier on have addressed this, but I think it's always worth reminding ourselves of the Bible, the diagnostic Bible by which these disorders, these illnesses are diagnosed. DSM-4 came out in 1994, and it was deemed pathological gambling at the time. If your gambling behavior met 5 or more of the 10 criteria up there. So you had to have repeated unsuccessful efforts to cancel or to stop gambling, become restless or irritable when prevented from doing so. If you lose money, return soon after to the scene of the crime and try to chase your losses. That's a core diagnostic feature. You have committed illegal acts such as fraudery and so on. Some really elaborate instances of fraud, often reported in the UK newspapers and so on, of individuals engaging in fraud to fuel their addiction. DSM-5 then came along. For some reason, we now don't talk in Roman numerals when we talk about the DSM. We now replace it with the digit 5 for no apparent reason. But it's also now called gambling disorder. And gambling disorder means that you meet a diagnosis of disordered gambling when 4, not 5, 4 or more of the following 9 criteria are met. DSM-5, in its ingenuity, has dropped the illegal acts criterion. So now 4 out of 9 of those criteria have to be met for a gambling disorder to be diagnosed. Within that, you can come up with a mild, moderate, and severe continuum of problems, of severity of problem. You may have detected a note of cynicism in my description of DSM. I'm a radical behaviourist. I'm an old school behaviour analyst. I don't believe that these diagnostic categories have any functional utility whatsoever. I'm a little bit more supportive of a notion of gambling disorder because it puts problems along a severity. A bit like what Robert talked about earlier on, you can have no problems, healthy problems, moderate, severe. That's fine. We can look at it as a continuum of severity. Some people encounter more problems than others, but to say that this is an illness, to say that this is a mental disorder, I have great difficulty accepting. I don't think it's useful for generating research also. Another method by which gambling is measured nowadays, is a very useful research tool, is the PGSI, the Problem Gambling Severity Index. You can do an illegal Google download like I have there and put a copy of it up there. You give 9 questions at your individuals, and again, you can come up with a severity of complaint, a severity of problem. Very useful for research purposes, and a lot of our neuroscience-based research at the moment employs just the PGSI to diagnose whether people have a gambling problem or not. Typically with a DSM, you should have a clinically trained individual administering it. Another useful measure, which I thought I'd raise for you here today, is the brief biosocial gambling screen. It certainly elaborates on the term brief by only being 3 items long. It's so short you can fit it on a fridge magnet. So I have a copy, some spare fridge magnets for you. If you've got a space on your fridge, I'll leave these out there for you, and you can diagnose gambling as and when people are approaching your fridge. Pardon? Yeah. Absolutely, yeah. You have to win at gambling to access the fridge. The Gambling Commission is our source of all things nationally representative in terms of data on gambling. Interesting that in their recent assessment, 0.7% of the respondents were identified as problem gamblers. That's according to the PGSI measure that I just outlined to you. 5.5%, however, were identified as at-risk gambling. And as we all know, if you're identified as being at risk, it's highly likely that you'll shift further up that continuum in that severity of problem and be identified a problem gambler. I would argue that we need to be doing an awful lot more to identify and work with those at risk of problem gambling. The gambling industry might say an awful lot of time is being spent devoted to problem gamblers, and it helps an industry mission to focus just on this extreme end of the severity continuum, but we should perhaps be focusing a little bit more on what happens with those at risk. It's notable also that there's been an increase in the type of gambling activity and the way it's contacted. 17% have admitted gambling online. That was an increase, 2% increase from the day before. Anecdotally, we can all probably identify that online gambling is probably growing faster than other forms of gambling. We're very fortunate to have data from Wales, specifically 4,000 or so respondents completed the Welsh Problem Gambling Survey in 2015. This is the first time the survey was undertaken. Very important that we undertake it again so we can compare trends. But as you can see, around 60 or so % of respondents had confirmed having engaged in gambling activity within the previous 12 months. If you exclude the National Lottery, it's relatively lower. But in terms of the forms, the activities that individuals engage in. Bingo is very popular. Slot machines are very popular. Spread betting and betting exchange are growing in, I would argue, growing in use. Bingo, particularly interesting. It's not a dying form. If you compare trends in Wales with trends from other similar prevalent surveys, you've got the HSE, which is a health survey for England. You've got the Scotland Health Survey, so you can compare within the 3 countries of Great Britain. Northern Ireland isn't represented in this. And you've got the BGPS, which is the British Gambling Prevalence Survey, of which there were 3 in total. The trends remain, across all those surveys are relatively constant, which is good intra-replication. So in Wales, around 1.1% of the population meet the DSM and indeed the PGSI definition of problem gamblers. But again, the at-risk rate in Wales is around 4%, comparable to Scotland. Within Wales, the age group most at risk of problem gambling are those aged between 16 to 24. These were identified in the Welsh Problem Gambling Survey. 7% of those identified as being at low or moderate risk of problem gambling. This is particularly so in men aged between 16 to 24, where the overall rate of gambling is 10%. In women, the risk of problem gambling is in fact higher in those aged between 35 and 44. Again, in terms of the activities that individuals within the young age range, 16 to 24, engage in, you can see that slot machines, machines in a bookmakers, often called fixed odds betting terminals or FOBTs, and online gaming and spread betting are particularly popular forms of gambling. So there seems to be clear trends between the well-charted growth in gambling advertisements, tailored around sporting events in particular. If, like me, you shout at the screen during BT Sport and Ray Winston's constant admonishment to bet, it's just that's a very clear anecdotal observation of the growth in opportunities to gamble, and indeed to gamble in a spread betting form, particularly accumulator bets. So that's some background in terms of rates and how it's done. What are the costs for these different forms of behaviours? As a public health challenge, and I would argue it is clearly a public health challenge, gambling is not an isolated form of suffering. Gambling addiction is not an isolated form of suffering. It contacts and it interacts with loads of different domains. So you can calculate health costs, welfare and employment costs, housing costs, for instance, statutory homelessness applications. You can look at criminal justice costs. And the BODs at the IPPR, the Institute for Public Policy Research, published a report, which you can download from their website, came out earlier on last year. And they identified in Wales alone that problem gambling is estimated to cost between 30 and 40 million pounds. In total, in Great Britain, it's estimated to cost between 260 and 1.1 billion pounds. So the scale that we're talking about, again, is beyond belief. So gambling is, I would argue, a public health issue. Some strands of evidence of support from this. Colleague at University of Bristol, Sean Collishaw, published a wonderful study recently, open access, you can get it from the British Journal of General Practice, in which they assess gambling problems in individuals waiting in GP surgeries, 1,000 patients in 11 GP surgeries in and around Bristol. And they identified that 1 in 20 patients walking through routine GP surgeries reported a gambling problem. The highest vulnerable population were, again, young males aged between 18 and 24. This suggests then that there's a hidden problem in healthcare provision for gambling, and that there's a need to recognise it in primary care settings. In addition to primary care settings, gambling addiction problems often come up in other financially involved settings, such as when an individual contacts citizens' advice bureaus, for instance, and there may be a debt or financial management worry, and with a bit of probing, there's a gambling issue at the foot of it. Some of the fantastic work that Katie Fry does at the Newport Citizens Advice Bureau down in South Wales is worth mentioning in that regard as well. They've got a dedicated problem gambling support service in their citizens advice setting. One of the best quotations you'll find on public health, the public health status of gambling is from Dr. Henrietta Bowden-Jones, Dr. Henrietta Bowden-Jones runs the NHS, the only NHS problem gambling clinic, and she said that problem gambling may have been a hidden illness in the past, but it's now one large and visible hot potato. Let's make sure it lands in the laps of those ministers and government officials who can finally make it an NHS concern and offer NHS services for those who are affected. And indeed, it's salutary in that respect to see that there have been similar calls from within the Welsh Assembly government for gambling addiction to be recognised as a formal public health concern. Again, you can read that editorial in BMJ. Finally, just want to conclude with some pointers to research on those most at risk. We've talked about young people. We've talked about some of the groups, maybe young people in particular, coming up in the public health domains in the surveys. Students, university students attending Bangor University and so on, may be at risk of problem gambling. The recent evidence that we've contacted from Canada by Shen et al., 2,000 or so, large sample size, 61% of those had gambled, 2.8% were identified as moderate at risk, and almost 1% as problem gamblers. So the prevalence rates for that student-selected sample are comparable to nationally representative surveys. So there doesn't seem to be anything special about being a student. They are comparable. So there could be a hidden problem amongst students. Anecdotally, in Swansea University, my colleagues in student experience services, or whatever it's called now when you don't have any money to pay your fees, are identifying around 3 in 10 of the students who cross their threshold with debt and financial management concerns actually have a gambling problem at the foot of it. And that seems to be growing. But again, evidence on this at the UK level, wholly lacking. Also wholly lacking are prevalence rates in groups who have a historical tendency to engage in high-risk behaviour. Armed forces veterans, particularly those during transition, having left the services, are often at risk of high-risk behaviours such as gambling and excessive drinking and unprotected sex and so on. And we have just recently completed the very first data set analysis of some old data on veterans, and we found that there were more veterans with gambling problems than there were non-veterans. These are quite old, these are community-dwelling veterans in England in particular, using DSM-4 criteria and so on and so forth, but it indicates that there could be a growing problem. Again, anecdotally, it seems that this vulnerable group could be in need of greater intervention. Sometimes people will ask me, my students will say, if I've got a friend, what do I do who's showing gambling problems, what can you do to help? And it's also, I think it's incumbent upon me in a presentation like this, if you're not already familiar with these sources, to point you in their direction. Gamble Aware is probably the biggest charity in the UK, quite a controversial charity because it's largely gambling industry funded, but I won't go into that debate for now. There's Gamblers Anonymous. Gordon Moody is a residential treatment service for gamblers. GAM Care is the national helpline. I looked to see if there was a GAM Care helpline number here in North Wales. There is one, but it's outsourced to someone called Beacon Counselling, but there is an Anglesey number, for instance, for GAM Care. The NHS Problem Gambling Clinic in Soho in London is an excellent source of support and insight. You may also be familiar with Winfred Ellis Owen's Beat the Odds initiative from the Living Room Cardiff, which he's going to talk to you about very quickly. If you're not already aware of it, there's an excessive gambling conference that occurs January 21st down in the Pierhead building down in Cardiff. Have a look on the website if you're interested in coming. Registration is free. There's some excellent presentations that's a great networking opportunity also. I'd like to thank the FIMT and Gamble Aware for funding some of that research in there. If you'd like to find out a bit more about the research, the veterans research in particular, then have a look at the site there. Thanks for your attention.